Amending international health regulations could have devastating effects on future health response plans that countries, including Canada, had in place and grant decision-making to the Director General of the World Health Organization, who's not a medical, Dr. Tedros. So if the WHO said to jump, would you say how high? Tamara Ugolini here with Rebel News, and the World Health Organization had a lengthy agenda at this year's World Health Assembly taking place in Geneva, Switzerland just last week. And I'm here to bring you some highlights from the discussions around the proposed amendments to international health regulations. The amendments were originally proposed at the end of January of this year, 2022, by the U.S. Assistant Secretariat for Global Affairs of the United States Government, Department of Health and Human Services, also called HHS, Lois Pace. And the basis was to apparently strengthen the ability of the WHO and member states to prevent, detect, and respond to future public health emergencies of international concern.
Tonight, monkeypox spreading further into the Americas.
At a later strategic roundtable, Pace can be heard here referring to misinformation around the pandemic response. Have a listen.
We still see a good deal of disinformation and misinformation around our collective action in pandemic preparedness and response. And that's going to trip us up. Right? The less people understand, the more challenge we have of getting that buy-in from each of our countries and all of these communities to support what it is we are trying to do in these halls and in these rooms. So if I don't have an answer to that question, but I would like that question and that challenge to be on the table for each of us.
The proposed changes are all outlined in a document from April 12th, numbered A75-18, titled Strengthening WHO Preparedness for and Response to Health Emergencies. Subheader, Proposal for Amendments to the International Health Regulations, otherwise abbreviated to IHR. I won't get too into the nitty-gritty of it all because, at least for now, this is all on hold. Thankfully, because the amendments basically gave the WHO, namely Tedros, sweeping powers to declare a global health threat without consultation by the member states, and the language was concerning around perceived versus actual threats of international concern, which is internationally concerning, all right? Because it leaves public health response at the helm of the WHO and no longer at the request of the state party. And while there are many concerning items in this document, including how member states are now mandated to establish a compliance committee, I also wanted to show you how voting happens at the WHO. Here's just one small example.
Islamic Republic of Iran. Is the Health Assembly ready to adopt this resolution? I see no objection. The resolution is therefore adopted.
The room is half empty, and I think that was maybe 5 seconds provided to object. Now, the international health regulations, the IHR, and pandemic preparedness response plans were a main topic of concern during the countless committee meetings and roundtable discussions at the World Health Assembly. The minutes were often pushed over onto other days, backroom discussions, hallway meetings. This appears to all be being managed by the Working Group on Pandemic Preparedness, which is short-formed to WGPR, as evidenced by Tedros' opening remarks from May 4th, 2022, where he essentially thanks the WGPR for their, quote, report to the historic WHA special session late last year that contributed to the establishment of the Intergovernmental Negotiating Body for a new WHO Accord on Pandemic Prevention, Preparedness, and Response. So I took a few clips of the two co-chairs of the WGPR, their opening presentations. The first was from Colin McKiff, he's former FDA, but is now the Director of Global Affairs at the U.S. Department of Health and Human Services.
There has been a clear commitment by all member states, for which we are very grateful, and a recognition as well that the status quo in so many ways is unacceptable, and that strong political will to work together through member state-led processes and with the valuable inputs and support of the Secretariat to develop recommendations to strengthen WHO, member states, and the broader global health architecture to ensure that the future we can more effectively prevent, prepare for, and respond to health emergencies.
He mentions the INB, which is that intergovernmental negotiating body. It's a new instrument just introduced in December of 2021 at the WHA's second ever special session. Its mandate is to draft and negotiate a convention, agreement, or other international instrument under the Constitution of the WHO to strengthen, there it is again, you guessed it, pandemic prevention, preparedness, and response. The second presentation was from other co-chair Grada Verdenkias.
Over time, discussion narrowed on a possible approach that would look at the package of limited targeted amendment while also underlining the need not to reopening the IHR. Member States emphasized that any IHR amendment take-up should be done in an inclusive, transparent, and member state-led process that built on the success of WGPR.
So they're restructuring the whole thing, and they'll continue discussions into November. And a representative from Canada delegated on the topic. I had to search quite a bit to find out who this person was, because no one actually introduces the speaker. They don't appear to be elected officials, so many people, including myself, don't recognize or know who they are. But this person appears to be Josie Waugh, whose name is on the official list of delegates. As per the WHO, she is listed as an alternate. She's the Director of Multilateral Relations Division and Office of International Affairs for the Health Portfolio at the Public Health Agency of Canada. Here is what she had to say about Canada and its role in the international health regulations.
There is a window of opportunity that we must seize to strengthen public health systems and enhance collaboration with other key sectors. This includes strengthening prevention, preparedness, and response at all levels to address emerging and future public health and health security challenges, such as pandemics and climate change. The WGPR has been a critical forum to advance these conversations, and we are grateful for the co-chairs and the Bureau for their leadership and perseverance in guiding member states through these complex discussions. We welcome the WGPR report, and in particular, the clear forward path to consider amendments to the international health regulations.
As of the daily update on the WHO's website, it appears that the only amendment to the IHR that was passed this time around was to reduce the time of entry into force of any future amendments from 24 months down to a mere 12. And they note that a comprehensive process for addressing future amendments to the IHR was agreed upon earlier this week. As reported by the Epoch Times, various African regions objected to the amendments, forcing further discussions to be moved to November. It appears that Brazil was among those who threatened to leave the WHO entirely if the health amendments passed. And all of this will fall under the new working group for international health regulations, the WGIHR. Regardless, these are unelected, unaccountable people who we don't even know who they are, making decisions and speaking on your behalf in foreign countries with foreign interests. Do they really speak for you? For the interest of all Canadians? Tell me in the comments below. For Rebel News, I'm Tamara Ugolini. If you are in alignment that our pandemic response should not be in the hands of foreign interests, then head over to our petition at nopandemicctreaty.com and sign that today. We want to uphold the health sovereignty of Canadians and at the same time send the government a message that their backroom deals and hallway discussions do not represent or reflect the interests of Canadians. That website to sign our petition, again, is nopandemicctreaty.com.